everyone on behalf of Scoliosis Corporation to the Facebook live streaming with Dr. Anthony Fong. And I would like to thank Ms. Amanda Boniface Kiamko, the founder of Scoliosis Philippines, who is also supporting us right now in the Philippines to broadcast this live streaming. So let us now welcome Dr. Anthony Fong. He is spine core bracer for adult and pediatric, and he is also the founder of Scoliosis Corporation in the Philippines. Welcome, Dr. Anthony Fong.
Thank you. Good morning, how are you? Okay, hi, how are you? I've had quite a lot of questions over the last few months since I've been coming back and forth to the Philippines. It's an absolute pleasure to be here. And so there's been quite a lot of questions about what is spine core, how does it work, what is the history behind it, and one of the pressing questions we always have is, who is it suitable for? So one of the things that we always talk about is, before we understand what it's suitable for, is to understand the history behind it. So I hope you don't mind, I'll be looking back and forth quite frequently. I'm seeing quite a lot of questions bouncing back and forth, so I hope you don't mind me looking up and down quite a while, okay? So spine core has been around since 1995, but the history behind it actually started all the way back in 1990. It started with an orthopedic surgeon called Professor Rivard, so Charles Rivard in Canada. So what happened was that he managed to secure a $12.4 million research grant into finding out the history behind all the different types of braces, the mechanism behind scoliosis, the cause of scoliosis, and also to find ways of how to tackle this pressing issue. So in 1994, that was actually when all the preclinical tests started. So after the 12 million was secured, then 65 different researchers in total were led by Dr. Collard. And so from here, it was all in St. Justine Hospital. And so it was in 1995 that all the treatment successes were starting to be published. So one of the things that we find with scoliosis is the number one question we always have is, who is it suitable for? So, and quite a lot of patients so far, or we have a lot of inquiries about, when do we use this brace? Who is it suitable for? Like, can it be used for all types of scoliosis? And what if a patient has a specific type of scoliosis? Can it be used at what curve or how large? Or in some cases, is it suitable for someone with a very large curve, or is the limits? So one of the things with spine core, with Scolio-Care, is that we're the exclusive distributors of spine core products in Philippines. So at present, we have quite a number of practitioners, and we're absolutely fortunate to have quite a lot of doctors in Philippines who are extremely interested and enthusiastic about this product. So this is now available in St. Luke's Hospital. So it's in St. Luke's Global City. It's also in St. Luke's Quezon City. You'll find this in Philippines Orthopedic Center. We also have this in Peak Orthopedic Peak Physical Therapy and Scoliosis Wellness Center, both in Manila and Davao. We also have this in Healthway, OrthoSport. This is also in Prime Care, and also in Philippines Rehabilitation Institute. So if you have scoliosis and you have any questions, by all means, do not hesitate to email us, and we'll direct you to the practitioner that is closer to you, that is more convenient. So one of the questions we always have is, how much is spine core? Now, spine core is actually, the pricing is fixed. So in UK, the Spine Corporation Limited, UK, they work very closely. So they coordinate, and they also advise us on what is considered the appropriate price, what is the fixed price, and so it becomes accessible to as many people as possible. Because if it's a good brace and it's very expensive. It's not going to be affordable, and unfortunately, it's just not going to be practical. So what we did over the last few months is that we've been working very closely with UK on trying to obtain the best pricing possible. So we've managed to secure the pricing down to a fixed price of 99,000 peso, and that's VAT included. So, and it also depends on the practitioner. So the component itself, the pricing is fixed by the spine corporation. However, the practitioner's bracing fee varies. So some of the practitioners may charge a fixed price, and some can actually fixed price. They can actually charge less for either the bracing fee, or they might charge less for, let's say, the review fee or initial consultation. So ultimately, the best thing is you can contact our website, and you will actually have a list of all the practitioners there and all the different centers where it's available. And from there, you can actually call them up. So you'll find that all the doctors are really, really approachable. And I've worked with many practitioners, and this is actually one of the greatest group of people I've actually encountered, and extremely enthusiastic. So I can see a lot of questions bouncing back and forth. So one of them is that, can you get the braces without going through rehab? Well, the thing is, in order to identify or to ascertain, do you have scoliosis, is that this has to be diagnosed by medical doctors. Okay, so the thing is that if you look at an X-ray, sometimes you might see an X-ray and it has a lovely, or it might have an S-curve. So one of the things is that when you look at scoliosis, there's so many different varieties. So for many years, if you look at Google, you look at the internet, you look at all the textbooks, the standard type of scoliosis they always talk about is either you have a curve on top, so we tend to call it a thoracic curve, and it could either be on the left side or it might be on the right side. Then the other one you may have is scoliosis in the lower back area. So once again, it may either be scoliosis either in the left part of the lower back or the right part. And in some cases, you may even have an S-curve. So sometimes with an S-curve, you may have a double curve. So some of the ones we've seen so far, that can be quite severe, 4 curves. And the most serious one we've seen so far is actually 3 curves in just in one section. So there's so many different varieties, and over the years, it's always been assumed that there's only a certain amount of curvature. So one thing about scoliosis is that in adults, there's about 12 types of scoliosis classification, whereas for children, there's 27 different types. So it's extremely important to understand what type of scoliosis do you have, where is the apex, where is the primary. So let's say you have 2 curves, one on the top, one at the bottom. So sometimes the traditional method is, okay, let's do an exercise and let's target the upper body, or let's target the lower back. And if that's not the primary source of where the scoliosis is coming from, then you may be only addressing the compensation. So if, let's say, I have a curve on top over here and I'm leaning one side, your body is not going to appreciate that. So you have your center of gravity will have to be balanced. So you may compensate by tilting the lower back or creating a curve in the lower back just to get you back online in the middle. So under these circumstances, we have to address where is it coming from. Because if you end up treating the compensation and you're not addressing the primary, in some cases, it may actually continue getting worse. Some of the questions I'm saying is that what degree of angle is considered recommended? So this actually comes down to, we go back to the history behind bracing. So for many years, it has always been the standard, the gold standard for bracing is always to use the standard hard brace, which is either the Boston brace or the Milwaukee brace. And for many years, this has been extremely effective in terms of preventing the scoliosis from progressing. In some cases, as we spoke to a lot of the rehab doctors, a lot of the orthopedic surgeons, they will say that, look, it's fantastic in keeping things under control, but they've also noticed that because of prolonged usage of the hard brace, your body becomes immobile. So if there is no movement in the body So one thing with a hard brace is that you may have to wear it up to 23 hours in a day. So if there is no movement for 23 hours in a day, your muscles actually become weaker. And over time, these muscles actually become lazy. And as time progresses, if you don't use that muscle, it will actually start to shrivel, or you get what we call disuse atrophy. I mean, I'm sure most men out there will tell you, if you stop exercising, your muscles will over time start to shrink. Okay, so you lose a lot of muscle mass. So imagine your spine, you have all these muscles around your back that is designed to maintain stability, and it maintains core strength, and it maintains support around the spine. So the problem is, if you're wearing a hard brace over a prolonged period of time, these muscles may become weaker, or you may actually end up having muscle wastage. So as the muscles start to shrivel, it starts to waste, then when you take off the brace, and this is the comment, recently I did a talk in Conrad with the Philippines Academy of Rehab Medicine, and the rehab doctors there were extremely enthusiastic about this, because one of the comments that we hear is that when they wear the brace, the spine looks absolutely fantastic. When they're using the Boston brace, that is, or they're using a hard brace, or Chanel brace, or one of those rigid braces. So they mentioned that they will look at the x-ray, and the spine looks absolutely immaculate. It's perfectly straight, or it actually has a nice reduced curve, or it appears to be stable. But the moment they remove the brace, the whole body collapses back into its original position, or it may actually be worse. And this was actually something that was addressed back in 2007 in the Journal of Pediatric Orthopedics. What they actually found was that if you have scoliosis and you're going to be addressing this condition using either non-surgical techniques. So one of the things is that some of the questions that I'm seeing is, how do you know when do you use the brace, or when is the brace suitable? Or in some cases, when is surgery most viable? So the standard guideline is that between 0 to 10 degrees, it is considered normal. Anything more than 10 degrees, you're classified as having scoliosis. So once again, don't panic when you look at the curve. So you need to see a doctor to get a proper diagnosis, because in some cases, it may be postural. Okay, so this is where it's important that you need to consult your doctor to have a proper evaluation to see if there's any asymmetry, not only in your posture, but in your rib cage, in terms of are there any rotation in the spine, or are there any evidence of rib humping? So that's when you lean forward and you actually notice one of your ribs on one side is more prominent than the other, or the lower back, there's evidence of rotation, or there's tilting, or you notice that the contour of your pelvis or your waistline is not symmetrical. So instead of looking like an hourglass, it actually looks more like a C curve, or in some cases may look like a double C curve, or you may actually have quite a large rotation in there. So if you're between 0 to 30 degrees, and it really depends on your age as well, and it also depends on, in many cases besides your age, it also depends, are you going through puberty, are you going through a growth spurt? So in 1984, Lonstein and Carlson, there was a research on this, and they found that children who are less than 10 years old, if they have a curve that is more than 20 degrees, then there's a 100% progression rate. So as they get older, that 20 degrees might not mean as much, but it doesn't mean that you should be a little bit more, you can say that a bit lazy, or in some cases, neglected, because in some cases, it may appear, your spine may appear to be stable, and then suddenly when you hit growth spurt, it can actually, in some cases, accelerate, or in other cases, it can actually start to become quite progressive. So there was another study done in 2010 as well, for example, in adults, where they look at adult scoliosis and they wonder, look, if I'm an adult, am I suitable for bracing? Should I be wearing a hard brace, or should I go for surgery? So going back to the history again, so like we say, between 0 to 30 degrees, you're classified as being manageable under most circumstances. And so things like rehabilitation, exercises, physical therapy, chiropractic, that can actually keep your spine under control. So in some cases, it is excellent for providing pain relief, and also for providing some form of stability in the spine. And in many cases, it can also help slow down the scoliosis to a certain point. But however, that depends on what stage of puberty you're going through. So if you're going through growth spurt, you may find that even the most amount of exercises is not going to change the scoliosis. And in some cases, you're only just buying time, or you're actually slowing it down. Now, if you're more than 15 degrees, so most cases when it comes to bracing, what are the indications for bracing? So if you're more than 30 to 40 degrees, and once again, this is age dependent as well, and also the rate of progression, you are more in the category of bracing. So this is actually where you have to ask, are you suitable for hard brace, or are you suitable for the dynamic braces? So in 2007, what they found was that if you wear the hard brace, in some cases, it was only found to be 15% effective, and only 21% of patients were able to avoid surgery. So 79% of patients actually ended up progressing towards surgery. Now, whereas in the case of spine core, it was found to be 3.9 times more effective than the hard brace. It was also found to be 3.7 times more effective in many cases, depending once again on your curve, on the progression rate, in actually stopping the scoliosis from having surgery. But once again, this is not to say that if you have scoliosis, that you must avoid surgery. In some cases, surgery is actually the only option. So when you reach a certain point where your spine is now more than 40 degrees, so it also depends on the country. In some countries, if your curve is between 40 to 50 degrees, some doctors will actually wait a little bit, and they will continue to monitor, explore other options. So they may recommend rehabilitation or exercise or other forms of treatment. But in other countries, they may recommend that once you hit 40 degrees, then this actually becomes more of a surgical candidate. So once again, it really depends on, are you having any other symptoms? For example, a patient may present himself with a very large curve. And I'm looking at some of the comments. Sometimes we see people, we have patients coming in or clients coming in, and their curve may be 60 or 70 degrees, and they have absolutely no symptoms whatsoever. And on the other hand, we may have patients coming in who are only 30 degrees, and they're already complaining of breathing problems, heart problems, or they're noticing palpitation, or in other cases, they may be experiencing paresthesia, tingling, numbness in the hands. So just because you have a mild curve doesn't mean that you're out of the woods. So this is important, that you need to see a doctor and discuss all the different types of symptoms or what type of discomfort that you're experiencing. In other countries, they will probably wait until your spine is between 50 to 60 degrees before they recommend surgery. Okay, so in this case, it really depends on your condition, your symptom that you're presenting. It also depends on the guidelines of the different countries. So in some countries, they're more conservative. They'll wait until it's more than 50 or 60 degrees. In other countries, they may recommend surgery after 40 degrees. So it's extremely important that you need to discuss this with your doctor, so that your doctor will be the best person to advise this. So in many cases, we also have patients asking, so when is the brace most suitable? So the guideline for spine core is that it is suitable for patients with idiopathic scoliosis, and between 15 degrees to 50 degrees. But once again, if it's more than 50 degrees, we will always recommend that the patient has to see a medical specialist, an orthopedic surgeon or rehab doctor, because you need to coordinate those type of cases with your specialist to see whether or not you're suitable. In our cases, for example, we may have a patient 50 degrees, for example, and or more than 50, say 55 degrees. For us, we will not brace that patient directly. We will actually wait first, or we will actually recommend that the patient should see an orthopedic surgeon to explore what other options are available. So sometimes the orthopedic surgeon may say, look, I will postpone the surgery for say 6 months, but between now to 6 months, I want you to try this brace. So sometimes the bracing may be used as a supportive device or a pre-operative supportive device, because ultimately the patient may still need to have surgery, but between now until let's say 6 months time, if the spine was untreated, there's a potential that the spine may continue becoming progressive and the scoliosis may become worse. So by the time the patient approaches the time of the surgery, then the prognosis might not be as favorable. However, if they have some kind of treatment, some sort of intervention beforehand, it can be used to strengthen the spine. It can be used to at least build up the core stability around the spinal area, maintain flexibility or strength. And so in some cases, either the brace can be used to try and slow down the scoliosis from getting worse, provide support, or in some cases, it's just to hold it there until the time of the surgery. So one of the questions we also have is that we have quite a lot of patients asking, saying, look, I'm an adult, am I suitable for bracing? You see, the indications for scoliosis is actually very, very different. So when it comes to bracing, so if you're a child and you're between, let's say you haven't had your menses yet and you're still growing, so before they hit puberty, it's corrected, or in some cases, to try and keep it under control. Now, when a child is undergoing puberty and growth spurt, your body is producing so much hormones, you're actually growing at quite a rapid rate. So in this case, so if you're growing at a very rapid rate, you might not be able to actually slow down the spine from getting worse, but at least you can provide some kind of, almost like pressing the brakes on a speeding train. So imagine if a train is flying down the track and you're not slamming on the brakes, you're going to hit something and it's going to get worse and worse, and it will actually start to snowball. So in some cases, you need to use something to try and slow that down until it becomes manageable. So this is actually where the brace is used. And one of the guidelines of spine core is that if a patient is more than 20 degrees, between 15 to 50, that is suitable for the brace. But if it's between 20 to 50, most times we will just brace. So there will be patients who will come in, young children who are 15 degrees. So if between 15 to 20 degrees, when do you brace this patient? So the general guideline is that if, let's say, you have a patient that has a family history of scoliosis, there's very strong indication that this patient has a family history, or they have a genetic predisposition for idiopathic scoliosis, then, and there's evidence that the spine is progressing over the last 6 months, then someone at 15 degrees will brace. So in the past, the patients between 0 to 30 degrees were not recommended for bracing. And one of the reasons being is that when they spoke about bracing, they were always referring to using the hard brace. So when you hear the concept that, oh look, your spine is between 0 to 30 degrees, you don't need to wear the brace. But that actually in reference to the hard brace. Because if you're between, say, 0 to 30 degrees, the common protocol is either to observe and monitor, to undergo some form of rehabilitation, exercises, chiropractic, physiotherapy, or to brace. But in the past, what they found was that if they braced a patient between let's say less than 30 degrees, and they were using the hard brace, the outcome was not as favorable. Because what they found was that they were wearing the hard brace, the muscles were becoming weaker, becoming lazier. So over time, they found that if they removed that brace, it actually got worse. However, when spine core was developed, its main purpose was not just to target the bone. So in the past, if your spine was tilted, the main objective of the hard brace is to target that spine in 3 different directions. So we call it 3-point pressure. So if you're hunching, the main objective is to try to straighten you up. So if your spine has rotation, it's out to counteract that. So if it's tilting, it's either to try and untilt or to go into the opposite direction. Whereas in the case of spine core, it works on a complete different, you can say it works on a different mechanism. So it is designed to target not only the bone, but the muscles and how your nerves actually activate. So over time, what it does is that if you haven't hit puberty yet, in some cases it can actually improve the overall structure of the spine or even of the vertebra. But once you go through puberty, you might not be able to do that. Now, and that also depends, are you born with a different type of, say, I'm having oh, wonderful, I'm back again. So I was having some reconnection issues. So your spine, when normal, should be nice and rectangular. So there are certain patients who are born where the vertebra is not rectangular. It can actually be almost triangular shape or it's wedged. That's what we call congenital scoliosis. Now, for those type of cases, there's nothing the brace can do to try and make you go from a triangular bone back to rectangular. That's absolutely just unscientific. If anyone claims that it can be done, I would run away. Okay, so going back to this, when we talk about the different types of braces, so what they found was that with spine core, because it actually uses a dynamic movement, so it actually works on correcting the way your body moves. It activates your biomechanics. It changes the way your body behaves. It also works on the muscles. It works on the bones. So it actually creates a loading force, unloading force, and that has been shown to actually stimulate bone growth. And whereas just statically opening up the bone does absolutely nothing to the spinal structure. So in this case here, what the spine cord does is that because it's also elastic, it works on muscles, so you're constantly getting muscular activation. So they found that with patients who were less than 30 degrees, if they wore the brace, it not only improved the muscle strength, but it also had a much better outcome than compared to using, let's say, a hard brace. Yeah. So go back to some more questions. Some of the patients, some of you are actually asking, I've had surgery, can we wear the brace? Unfortunately, no. If you have had surgery and you have the metallic fixations in the back, unfortunately, the brace cannot be used for that. Because in order for the brace to work, there has to be movement. So the main objective of the brace is movement. Because what movement does is that it actually stimulates the different changes in how the body behaves, how it reacts as well. So we also have someone asking, they're 25 years old, they have a 12 degree scoliosis, and they were advised to wear the brace. So the objective of the bracing is very, very different if you're an adult or if you are, let's say, a child. So if you're a child, the main objective of the brace is either to try and correct that structure, or in some cases, you might not be able to correct it, but to try and slow it down from getting worse. Yeah. And, oh, sorry, the person asking the question, let me see. So I'm getting a lot of questions flying back and forth. Okay, so that's for Marianne Mendoza. You're asking about your curve. It's 29 degrees, and you had your x-ray taken last month. And it's a moderate curve. It's a mid-thoracic, so it's in the middle area. It's 34.9 degrees, and there's a compensation in the lower back. Can it be used? Oh, Judy, can I have that little skeleton? Yeah. Okay. Thank you. So if you're looking at your curve, Marianne, so you're mentioning that you have a 34-degree curve. So your spine, when normal, from the back view, this is the back view here, it should be absolutely straight. I know this one is not very straight. Okay, we use this for a demonstration quite a lot. So from the back, this is actually your pelvis. This is the lower back, upper body, that's the neck. So your skull should normally be sitting, or your skull actually sits over here. So if you have a dextroscoliosis, meaning that's actually tilting off to the right side, your curve will be tilted to one side here. So to counterbalance, your body will actually tilt back the other way. So you end up with more like an S curve to try and keep it balanced. So your curve would be quite suitable for bracing. So in many cases, when we're looking at when are you suitable for bracing, it depends on the objective and your expectation. So if a child, your aim is to either to provide some correction or to try and slow it down from getting worse, or in many cases just to provide support. and or in other cases is actually to try and strengthen the spine, improve the way the spine behaves, so improving the biomechanics. So overall, SpineCore is actually designed as a global re-education of the body. Now, in the case of adults, and we actually have quite a number of people asking over the last few weeks, they've been emailing us wondering that, look, I'm an adult, and I've been advised that the bracing does. Said that, look, my orthopedic surgeon said I shouldn't waste my time using the brace to try and change my scoliosis because I'm an adult. And the answer is, well, actually, yes and no. So it is quite correct in many ways, and it's also there has been a lot of research that has been done recently. So in adults, when we use the harm brace, the number one objective is actually pain management. In adults, it is not designed to try and change your scoliosis. But however, that being said, I know most of you have been looking at Amanda, and you've been following Amanda, and you notice that her spine changed from 50 degrees and has gone all the way down to 25. And the lower back has gone from 38 down to 25 degrees with the brace on, and without the brace, it's around 38 degrees or so. And you're wondering, well, you just said that in adults we can't change scoliosis. Well, the thing is, our number one objective in adults is not to target the curvature or the scoliosis. But if your spine improves as an adult, we always call that an absolute bonus. And so the question is, do we have a lot of adults who wear the brace and they see changes in the spine? Absolutely. Okay, so we do see quite a lot of adults. And it also depends on your flexibility as well. So if you're an adult and you're flexible and you wear the brace, in some cases you may see improvement in the curvature. But once again, that is not the main objective of wearing the SpineCore brace. So in adults, the number one objective is to manage your pain. And studies have actually shown that if your spine is tilted, let's say sliding off to the side, so it's translated more, say 12 millimeters to 16 millimeters, your spine becomes quite unstable. So under these circumstances, your muscles, your ligaments are being stretched to a certain limit. And over time, it causes instability. It will then affect your posture. So put pressure on your joints, on your disc, on your nerves. So over time, patients actually start to develop pain symptoms. Now, that being said, we do see quite a lot of patients who come in with really large curves and they have no symptoms at all. And there are quite a lot of patients who come in with very mild curves and they have absolutely severe pain. It's excruciating. So this is why, in order to see whether you're suitable for the brace, you need to have a proper evaluation. You need to have a proper assessment. Because one of the things that we look for is that what other symptoms are you having? So we have to rule out, is your scoliosis suitable? Because there are certain types of scoliosis that that SpineCore will not be suitable for. For example, if you have a genetic condition like Marfan syndrome, where it actually targets the connective tissue, or you will see children who are 12 years old and they're almost 6'5", okay, and they're just growing at a very rapid rate. Marfan syndrome cannot be used. For patients with Marfan syndrome, SpineCore cannot be used for you, unfortunately. If a child has a cerebral palsy, the SpineCore cannot be used. So if someone has, say, severe Parkinson or Alzheimer's, then the brace is not suitable. So it really comes down to having a proper evaluation assessment. Now, our providers in Philippines, they're absolutely excellent. They've actually gone through the training. They've gone through, and if you talk to them, they'll tell you it's not an easy training. So it's actually quite grueling. Okay, it's long hours of hardship going through. I know when we train the doctors or the practitioners, we are very, very strict, and we have to be, because scoliosis is one of those conditions where it's not a game. You don't play with it, and you need to manage it very, very carefully, because otherwise the spine can actually be left unchecked and become very, very progressive without acknowledging it. So going back to adults, so we also have questions about if my curve is very big. For example, Diane Bonto, you mentioned that you had surgery back in April and you were in the hospital for 6 days. you're able to walk after 1 day after surgery, and it's now 2 weeks and it's still fresh. You mentioned that your breathing is much better. That's excellent. But see, one of the things is that when it comes to surgery, it's extremely important to discuss all the conditions that you're having. So you have to reveal and disclose absolutely every type of discomfort, all kinds of symptoms that you're expressing, and you must let the surgeon know. Sometimes a lot of the surgeons, when we have discussions with them, one of the things they always say is that sometimes patients actually get too embarrassed, or they get very shy, and they don't reveal everything. For example, in some cases, if your scoliosis is quite severe, you may even have nerve compression, and in some cases you may even have weakness in your bowel or your bladder behavior. And this is extremely important. You need to let the doctor know that, because in those cases it actually can be quite urgent. So that can be an emergency. So you need to let doctors know about that. So if you're having breathing problems, even though you might feel that, oh look, maybe I'm just not fit, so I'm having a bit of breathing problem, maybe I need to exercise more. And actually in some cases it could be, but in other cases, if your curve is becoming more progressive, you may be applying more pressure on your lungs and your heart. And over time, you may actually think that it is actually a normal pattern, but you need to let the doctor know. So the doctor will be able to discern whether or not that's normal, or look, it's you're becoming a bit too panicky about this. So you need to let the doctor know about every symptom that you have. Okay. So getting back to in terms of your auntie having surgery 5 years ago, she had surgery twice, she's okay. That's excellent, because you see, we do get a lot of cases where patients have had surgery and they have corrective surgery, say 3 times. So they may have had surgery before they hit puberty. Then once they start going through a growth rate, they have another option is to wear another brace. Sorry, I was just distracted by Jeannie just then. So in those cases where they've already had surgery before puberty, then once they go through a growth spurt, they may need to do a second surgery to either have the rods elongated or to replace some of the components. And then once they reach a certain point where they're stable, they might have a third one. So once again, it really depends on the type of scoliosis you have, how severe it is, or whether it's moderate. So only your surgeon can actually tell you what to expect. Okay, and you have to have your expectations addressed. Okay, Lorraine, you mentioned that you're 25 years old, your curve is 12 degrees, your rehab doctor advises to use the brace for your waist, and you feel that the muscles are getting tight. Should you continue wearing it? Well, it depends on what type of brace you're about. So if you're at 12 degrees, spine core is not suitable for that. So you can actually do exercises, and that will actually help build up your spine. But in terms of the brace, it really depends on why your rehab doctor actually referred you for that. So for example, in some cases, if someone is experiencing instability in the spine, or they're experiencing a lot of pain, then the brace can be used temporarily to provide some kind of support. So I'm not in a position to tell you, yes, you should actually stop wearing it or not, but it comes down to understanding what was the main reason you were referred for the brace. Was it to provide some kind of structural support, stability? Was it actually to maintain some kind of tightness, a corset-like effect around the pelvis to give you pain relief? So you need to discuss that with the doctor. Darwin, hello Darwin. So Darwin, you mentioned that you have a daughter. She's 12 years old. She has a 16-degree curve, and you're quite concerned about that. Yes, I do agree with that. So at 12 degrees, at 12 years old, 16 degrees, it also depends on the progressive rate as well. So I would absolutely recommend that for her, even though the curve may appear mild, go and see one of the practitioners. They'll be able to let you know. They will do the assessments. It's almost like a 50-point check. The practitioners actually go through quite a lot of evaluation. So it's not a simple test such as just bend down, let me have a look and see which side is higher. So in spine core, the doctors are trained to assess all the different fine details in terms of rotation. So there's a clinical assessment, and it's actually quite a comprehensive clinical assessment. There's also a radiological assessment, so they will go through the x-rays and they will look for all the different patterns and try and ascertain what type of classification you have. So if the scoliosis appears to be quite mild, then you may actually end up being referred for exercises. But if they notice that there's a specific type of scoliosis and there's a pattern that is actually becoming more established, then they may recommend the bracing. But once again, before we can say whether or not your daughter needs to be braced, go and see one of the doctors or one of the practitioners that's close to your neighborhood. So we have another question here. You're already wearing the spine cord brace. Is it best that you lose weight so you can improve faster? Okay, Miss Pam, hi, how are you? So this question is very interesting because we do get a lot of people asking, look, I'm actually quite a big size, so should I lose weight and is that going to improve my scoliosis? And in many cases, the size of your body has absolutely nothing to do with your scoliosis. Okay, so in the past, there's also another saying that if you have bad posture, your bad posture causes scoliosis. And studies have actually shown that there is no correlation between that. So, and before you decide that, look, I'm going to start hunching anyways, but since you said that there's nothing to do with scoliosis, I didn't say that. So what we're actually saying is that in most cases, if you have bad posture, over time, it may lead to postural instability. But, so posture doesn't cause scoliosis, but if you have scoliosis and you have a predisposition for scoliosis and you have bad posture, your bad posture will make it worse. Okay, so if you like to hunch and all that, so young kids, if you're listening, absolutely correct. When your mom tells you to sit straight, you really need to sit straight. Because if it's not for your scoliosis, it's for the rest of your spine. So you may put undue pressure on different parts of the structure. We have Pam. You mentioned that you're 14 years old, and since you've been wearing the brace, it's been 2 years now, it's not improving, it became worse. In the case like yours, Pam, one of the things we look at is that at 14 years old, it usually depends on what stage of puberty you go through. So once again, it's also about addressing your expectation. So when a lot of patients decide that, look, I want to wear the brace, the first thing we always ask is, why do you want to wear the brace and what are you expecting? So in many cases, a lot of patients say, look, I have a curve and I want you to make it straight. Now, to make a curved spine go back to straight, meaning that there's absolutely no curve in the spine, that is not the objective. Now, do we get patients whose spine go down to zero? The answer is yes. So can we absolutely guarantee that if you wear the brace and your spine goes back to zero, it becomes straight? The answer is no. Absolutely no way in the world. And even when it comes to surgery, and most surgeons will say this, so even despite doing something like surgery, can it make the spine straighter? It will improve. So do they get cases where it goes down to zero? I'm sure they do. But can they absolutely guarantee, even with surgery, they can get your spine down to zero? The answer is no. So it is about addressing the expectation. And in your case, if you're 14, your body is most likely undergoing a rapid growth rate. And so the brace in these circumstances is actually designed to try and keep that scoliosis under control, to try and slow it down first. So in some cases, we have patients who come in where we've noticed there's a pattern that the spine is progressing at, say, 2 or 3 degrees a month. And when we start using the brace, you haven't stopped the scoliosis. So the curve will continue increasing. But instead of increasing at, say, 3 degrees a month, it starts to slow down to 1 degree a month. Then you'll notice that over time, it actually slows down to, say, 1 degree in 6 months. So it is still increasing, but at a much, much slower rate. So your curve may continue becoming progressive. But however, if you're wearing the brace and you're noticing that the curve is getting worse, it's not under control, then please speak to your practitioner and let them know. You need to have your concerns addressed. Now, the other thing is this: with every single patient that is actually being braced by spine cord actually monitors every single practitioner in their early stages of training. So during the whole 2 years of training and certification, every single patient that is being braced, being assessed, evaluated, all the data has to be inputted into the database. So there is a spine core database where the practitioners from UK will be able to access this, and they'll be able to go through the different evaluation, the clinical assessments, the radiological assessments, and they'll be able to see whether or not the classification is correct. So before a patient gets braced, usually a 1 or 2 week period has already passed before the practitioner is allowed to say, handle the patient. So in this case here, most times that you have an evaluation, let's say if you're in the Philippines and you see one of the practitioners, then they will have to input all the data, all the information into the software, and then the trainers from UK will actually look through that information, and then they'll be able to give feedback to the practitioner and say, look, you may need to modify this, or based on your assessment, I would recommend the following. So then the practitioner will be able to modify or enhance certain types of bracing. Yep. So when they're modifying it, they may be advised that, look, the brace was good, what you did was great, but I need you to concentrate more on the lower back or more on the upper body, reduce the rotation more, or work on the tilt. So once again, if you're concerned, please let your practitioner know. Okay. And you mentioned that one of the recommended exercises and therapy to avoid worsening your scoliosis, your curve is 25 and 22 degrees. That is actually quite a challenging question, because there's so many different types of exercises. One exercise may be suitable for one person, may not be suitable for another. For example, you will always hear people recommend doing yoga or Pilates or some sort of CrossFit exercise or some form of stability exercises. And whilst that may be suitable for some patients, it might not be suitable for others. So for example, we have some patients who have a certain type of curve, and then they do Pilates and they notice that, wow, if I combine my bracing and I'm doing my Pilates at the same time, then that actually helps improve the stability around the spine. Then on the other hand, we do see other patients where they have scoliosis and they do the Pilates exercises and it had either no benefit or it actually made it worse. So, and when we talk about making it worse, you can't really go and blame the exercise for it. It could be that the exercise was targeting a different area, or either wasn't done properly, or there's so many different factors involved. So one of the things we always talk about when it comes to exercising is, if let's say you do have the brace, then we always recommend the most effective way of using the brace is while you're awake and you're active, because that will also work on your biofeedback, the way your body communicates with the spine and the way your nervous system will communicates with the rest of your muscles. So it's extremely important to wear the brace while you're active. Now, Pam Reed, you mentioned that you have a scoliosis in your first check. It was 28 degrees. You wore the brace for almost 2 years and it's not. Once again, it really depends. When you're an adult, the main objective of the brace is pain management, and it's also for maintaining stability. So as an adult, your main objective of the brace is actually to keep the spine under control or to reduce pain. It's not designed to reduce the curvature. Although that being said, quite a number of patients that do have their curvature reduced. Yeah? Now, Nika Regime Liko. Hi, how are you? Now, you mentioned that you were diagnosed with 30-degree scoliosis and you qualified for a spine core. Is there a specific body but once again, when it comes to scoliosis, we tend to see that your body size really has nothing to do with it, because one of the biggest things that we see when it comes to scoliosis is quite a number of patients that you see are either quite tall and lanky and quite lean. But that's not to say that if you're tall, lean and lanky, you are likely to have scoliosis, because you will see patients who are not very tall, they're quite large, and they have scoliosis as well. So when it comes down to your body type or your posture, your physique, that really doesn't have much to play with it. Okay, unless of course, you're extremely tall, you're very lean, then in some cases, some studies actually say that it predisposes you to scoliosis, which is not always true, because we do come across a lot of people who are very tall, very lean, and have no scoliosis whatsoever. Now, talking about posture, so we do see a lot of people actually asking, if someone comes in and they have very bad posture, is that an indication that you may have scoliosis? The answer is we don't know. You need to have that assessed, because there are many cases that we see patients coming in and their posture looks absolutely horrendous. So they may be slouched over one side, one shoulder higher, the head is tilted, and they're leaning forward. And that would usually look like the classical scoliosis posture. But when we refer them for an x-ray, their spine is absolutely perfect. And we have patients who come in whose spine is perfectly straight. You know, they've practiced ballet before, or they've done some form of so-called, let's say, postural awareness exercises. And yet, when we send them for an x-ray, the spine is actually an S-curve or triple curve. So once again, how you look does not determine, does not indicate what your spine looks like either. Okay. Now we have more questions here. Okay. There's more questions. Seems like I've actually met. Kamina Mercado. So you were asking, are there any other ways, at least, to reduce a 70 to 80 degree curve rather than surgery? And you're hoping that, are there any other options for that? That usually when your curve is more than, say, 40 degrees, so once again, it goes back to the country. So every country has different guidelines, and you need to discuss this with your doctor and your surgeon. So if your curve is more than, say, 40 degrees, or in some cases 50 degrees, then you usually are a good candidate for surgery. But once again, before they do surgery, and for example, like in Indonesia, we will actually work very closely with orthopedic surgeons here. So our center, we work very closely. We have very good relationships with the orthopedic surgeons, and what they do is that whenever we send patients to them who have, say, a large curve, for example, like a 60, 70, or 80 degree curve, they will have their team ready. So what they do is that they will do a cardiac check. They will check your breathing. They will check the rest of the body. So you need to have an overall full assessment to see whether or not you're suitable for surgery. Because in some cases, they may find that, look, a patient may have a curve that is absolutely suitable for surgery. It is perfect, but during the assessment, they notice that your heart might not be suitable, or you might not be fit enough to do the surgery. So this is actually where you need to discuss with the surgeon. But going back to your question, are there any other option other than surgery? That's a very tough question, because it really comes down to what sort of symptoms are you experiencing. For example, we may have patients who have 70, 80 degree curve, and they're already an adult. And some doctors will say, look, if it's not bothering you, just leave it alone. But on the other hand, at 70, 80 degrees, there is quite a fair bit of pressure on the spine, and there's a lot of undue possible bone deformity that can form. For example, you may have remodeling of the spine, bone spurs, disc problems, degeneration in future. So this is something really you need to talk to your doctor about and ask them for their advice. And if you decide that, look, I'm not going to do surgery, then you can actually talk to your rehabilitation doctors and your rehab doctor, have a coordinated appointment and talk to them and say, you know, what options do I have? If I don't want the surgery, what do you recommend? So your doctors are extremely fantastic. So when I gave my talk in Philippines Orthopedic Hospital and also in St. Luke's, I was actually quite amazed. And we did quite a lot of talks in Philippines. So we've been to many islands, from Davao to SBMC. We've been to Tibo. We've been to goodness knows how many different hospitals we've spoken. And it is actually quite amazing that in Philippines the doctors are very updated. Okay, so the doctors are very up to date with the latest research. They know a lot about the current understanding of scoliosis and the different approaches. So, and quite amazingly as well, we find that the doctors are very approachable. Okay, so in other places that I've been to, there is actually quite a bit of a distant type of approach. So where the patient is actually quite terrified of the doctor. And we find that in Philippines, the doctors are just fantastic, yeah. And so please talk to them. They're very, very approachable in this sense, okay? Okay, okay, Miss Emily. Okay, so I'm flicking through the questions here. Givel and Gravado Bocena. Hello, hi, how are you? You have scoliosis 31 degrees, it's an S curve. What is the best sleeping position? Ooh, okay, now that's a really good question. Now, when it comes to sleeping position, a lot of people will actually say that, number one, you need to sleep on an absolutely hard mattress. Okay, they will say that the mattress has to be so hard you can almost play table tennis on it. Okay, that's actually not true. Okay, it's because one of the things is that if you sleep on a very hard mattress or a bed and you have scoliosis and you have, say, rib humping or you have deformity in the pelvis or in the lower back area, then unfortunately what will happen is that you can actually cause some bruising or some discomfort there. So you still need some form of cushion or some sort of a spring mattress actually to provide you support there. When it comes to sleeping position, your body twists and turns quite frequently at night. So you may be lying facing upwards, and then later on you'll be twisting to the side, and then you'll be lying facing downwards. So ultimately, at the end of the day, during the night, your body can actually keep turning more and more or flipping back and forth. Ideally, the best position is actually lie facing upwards, but it's not something that you can avoid. So if you try, you can try this. If you imagine you're sleeping on your left hand side and you try and force yourself to stay in that position, it's going to be quite challenging. So when it comes to the sleeping position, it's whatever is most comfortable for you. Because some patients, you may find that you tell them, look, the best position for you is like facing upwards, but they have a severe rotation in the lower back area, and in the upper body they may have the ribs actually prominent, and lying on the back can actually be quite painful, whereas for this particular individual, lying on the side may actually be better. So once again, it really depends on your scoliosis, so it comes down to comfort. Now, for Fos Malik, hello Fosmas, how are you? So you mentioned that you have scoliosis and your Cobb's angle is 30 degrees, it's in the upper body, 25 degrees in the lower back. You're thinking of buying the spine core. You're wondering about, are there any restrictions to movement and how long you have to wear it every day? That's a very good question, Fos. When it comes to spine core, it does not cause restriction. Okay, so we have patients who use the spine core and they participate in hip hop competitions. And we actually have a girl who actually won the hip hop competition while she's wearing the brace. This is quite interesting. We have patients who are ballerinas, we have gymnastics, gymnasts who do it. We have martial arts fighters, we have people who do MMA or in some cases Muay Thai or martial art or Kung Fu. And they actually wear the brace while they're participating in the sports. So once again, when it comes to spine core, so when it comes to spine core, it is extremely important that if you wear the brace, you can use it for the exercise. And exercising while wearing the brace is fantastic because that will actually help stimulate your muscles, strengthen your back as well. Darwin, thank you very much. Thank you for your good wishes. For each Nazal, you're 22 years old, you have scoliosis, dextroscoliosis, what should you do? Each, I would absolutely recommend, please go and get a check, find out what type of scoliosis you have to see whether or not your scoliosis is classified as being mild, moderate, or a bit severe. And there are many options. So once again, with spine core, all the practitioners of spine core are taught to evaluate and assess what type of scoliosis is suitable for bracing. So if, let's say, you went down to one of the practitioners and you really want the brace, and they do their assessment, they do the evaluation, and they say, look, unfortunately, you can't wear this brace. So the doctors, the practitioners have been trained to evaluate, in this case, whether or not you're suitable or not suitable for the brace. But once again, when it comes to the diagnosis of the scoliosis, absolutely recommend, please go and see a doctor. Okay, because when it comes to the diagnosis of scoliosis, looking at an S-curve doesn't mean that you have scoliosis. So you need to go and talk to a doctor and say, do you have scoliosis, and get a proper diagnosis from that. Yeah. We have Mark Crispia Nina Noga Balbuena. Hi, I hope I pronounced your name right. How are you? You're 28 years old. You're diagnosed with scoliosis in the lower back area at 17 years old. Age 17, there's 22-degree curve. Now you've been experiencing pain. Scoliosis is painful. Yes, it can be. Are there any intervention for back pain? Once again, when it comes down to scoliosis, it really depends on what type of curve that you have. And it also depends on where is the curve and what type of curve you have. So in most cases with patients with scoliosis, they may have absolutely no symptoms. And having no pain, no symptoms does not mean that you have no problems whatsoever. For example, there are a lot of nerve compression problems. There's a lot of spinal deformities, or even something like, classic example, someone who's having cancer might not even have symptoms until it reaches a certain stage. So with scoliosis, we have patients who have severe scoliosis and they have absolutely no symptoms. But we have patients who come in where they're only 20 degrees and they're having excruciating pain. They've got tingling numbness in the legs. So it really depends on how your body is adapting, how it's coping. So we have patients who cannot cope with this type of conditions, and others, they seem to be quite resilient. So once again, if you don't have any symptoms, it doesn't mean that you're out of the woods. Yeah? We have Judy May Sanglai Sylvester. Hi, how are you? Hope you guys don't mind, my pronunciation might not be correct. Yeah. So your doctor actually diagnosed you as having a thoracic scoliosis. You never feel the need to go back to the doctor because the signs of scoliosis, you don't feel it, rather than my right shoulder is lower. Once again, going back to this question, if your doctor diagnosed you as having scoliosis, I would recommend go and get an evaluation. You can actually go and see one of the spine core practitioners or one of your doctors in your vicinity and get their advice on that. All the spine core doctors have actually been taught different types of corrective movement. So if you go to them, they can actually recommend different exercises for you, other options, or what other alternatives that you can use. So if you decide that, look, you don't want to have the brace, absolutely fine. You can still find the spine core doctors or any of your rehabilitation doctors and get them to give you an advice on that. Yeah? Okay. We have lovely Rose Castro Filafute. Hi, how are you? You're 28 years old, you have scoliosis, and should you keep carrying your child? When it comes to this question, I know that even if I tell you, Miss Rose, you should not carry your child, you're not going to listen, because most likely you'll end up carrying a child anyway. Okay, when that child is screaming and yelling, you're going to carry the child. But once again, unfortunately, this is one of those questions where it really, if you have very bad scoliosis, and in some cases, if you have scoliosis, any kind of weight bearing or loading of the spine, increased pressure on the spine, it might not be beneficial for you. So in those cases, it also depends on the child. For example, if it's a real baby, sometimes there's really no choice. So we do tell patients that if you have a baby and you're still breastfeeding, then rather than walking around holding the baby, you can actually be propped up sitting, have a pillow on your legs, let the baby rest on the pillow, and use that for breastfeeding. But if it's a toddler, don't carry the toddler. Let them run up and down. That is the best thing you can do for the spine. Because when it comes to children, at that age, they're discovering the world. They're trying to discover the environment around them. They want to touch things, grab things, they want to run. So the best thing to do is let them be free, because that is absolutely beneficial for the spine as well. Because when you're a child, you start off as a baby, then as time goes by, the first thing that happens is the baby will lie on the tummy and lift its head up. So as the nerve starts to mature and it travels down the spine, the first thing that occurs is the muscles around the neck and shoulders start to strengthen. So the baby will be able to lift its head. And then from there, as the nerve starts to improve further and further down the spine, the shoulder muscles, the muscles of the arm start to strengthen up. So now you see the child doing almost like a push-up. So in yoga, they call that salute to the sun. Okay? So they're lying on the tummy and they're propped upwards. So they look like the Sphinx. And then as they get stronger and stronger and stronger, the lower back area starts to become stronger, and they're now doing the military crawl. So you see them dragging, crawling around the house, and then as the back starts to improve, they're able to use the legs and they start moving. So as time goes by, they will start to learn to stand. So when they start standing, this is actually where the back muscles start to develop, and that is extremely important for children. And that crawling phase actually helps the coordination of the spine, so it actually helps improve the spine, and you have cross reflexes that have been activated. So if you have a child that's a toddler, let them run. Okay, that's the best thing you can do. It'll do your back an absolute pleasure. For Miss Pam Pamri, thank you very much. You're absolutely welcome. I think in Philippines you say walang anuman. Yes. Andrew Bertes, you mentioned that you have a 4-year-old child. She has a L3 hemivertebral congenital scoliosis, 40 degrees. Does she need surgery? And can she use the brace? For your child with a hemivertebra, this is the one where when you look at the spine, the normal spine is usually rectangular like this. This is the front view. So this is actually the back, I beg your pardon. So this is the back of the spine over here. Okay, so that's the back of the spine. So in the case of hemivertebra, the vertebra is, instead of looking rectangular, it looks almost like a triangle or wedge. Now, under those circumstances, if your child is very young and it's 40 degrees, unfortunately, you really need, this is something that you need to talk to the doctor about, and surgery may be the best option, because with such a huge curve for a 4-year-old child, it can actually put quite a fair bit of undue pressure on the nerves and other parts of the body. So, so once again, if your doctor recommended surgery, I would unfortunately have to say that it's unavoidable under those circumstances. Now, is the brace suitable for a child with that is with a large curve? The answer is no. So if your child is 4 years old and the curve is 40 degrees and they have hemivertebra, the brace is suitable for many, many different conditions. And unfortunately, in this case here, you cannot wear the brace. Okay, so it's quite unfortunate that we can't use the brace for that. So once again, the surgery may be the best option. Okay, yeah. Ms. Foss, thank you very much. It has been an absolute pleasure. For Miss Yuna as well, thank you very much. And Bubot. Sateza, that's a very familiar surname. Yeah, thank you very much. Okay, now we have more questions. Okay. Hello Jai, you are 17 years old and your curve is 24 degrees and 22. That is actually quite an excellent, you're very good for spine core bracing. So once again, when it comes to bracing, the brace is actually not just about reducing the curve. So when you go and see, and when you do consult any of the spine core braces, you need to explain and discuss with them what is your expectation, what is your objective of the brace. If you say that, look, I want to get a brace because I want my spine to be straight, then you may set yourself up for disappointment. But if you say that, look, I'm interested in having the brace because I'm concerned about my posture, my scoliosis, or I'm worried that this is going to be progressive, then the practitioner will do their evaluation to see whether or not it's justified. And if they do find that it's justified, then they can say, yes, we can recommend the bracing. But if they do their assessment and they find that, look, at the end of the day, we can try the exercises first. And if they find the exercises are helping you, then you may actually probably at the end of the day don't need the bracing. But once again, at 17 degrees, 24 on top, 22 at the bottom, and S-curve, that is actually a very good range for scoliosis. And given that the curve is actually quite moderate, and you're 17, there's a certain amount of flexibility in the spine. The prognosis for this age is usually actually quite good. So I'd recommend go and see one of the spine core practitioners. Yeah? Okay. So we have 5 minutes more. I have Ginny here, and we also have Amanda chasing me. So Ginny is telling me that we have to wrap it up soon. Hello, Miss Trixie. You're 19 years old. You have 20 degrees, and the doctor said you don't need to wear a brace. You'd like to know about spine core, we can decrease the brace. In many cases, as we mentioned earlier, in the past, whenever doctors mentioned the word brace, it was always in reference with the hard brace. So in the past, if your curve was say 20 degrees and you wore the hard brace while you're still in puberty, I know at 19 degrees you're thinking, I'm an adult already, okay, stop calling me a child. Okay, it really depends. Your spine is still developing. Okay, in most cases it can develop even up to 21 years old. Okay, so in this case here, your body is still developing. So at 20 degrees, if you were wearing a hard brace, then absolutely I agree with the doctor. You are not suitable for wearing a hard brace, because with a hard brace, it actually can make your muscles weaker, and it can actually cause quite a fair bit of instability over time. And a lot of the rehabilitation doctors that I spoke to during the seminar, they actually expressed a concern that previously the only option for scoliosis is the hard brace, and there were no other options available. So they were very happy that SpineCore is being introduced into Philippines, because now there's more arsenals available. So they have more options. So rather than constantly relying on just the hard brace, there's more alternatives now. And SpineCore has been around since 1995, and over the years, it has been tested in over, let's say in this case here, all the different countries around the world. So all around the world, it's been tested on over 400 patients over 10 years. So this was actually not a short-term study. It was a 10-year study over 400 patients, and they actually found that it was 89% clinically effective. So it's not something that has a small success rate. But once again, although the effectiveness and the success rate is quite high, you need to see whether or not you're suitable for the brace. For example, it may be perfect for other patients, but might not be for you. So once again, in this case here, go and see one of the practitioners. Discuss with them what is your objective of wearing the brace. So if you're wearing a hard brace at 20 degrees, I do agree that it can weaken the spine, and so you're not suitable. But when it comes to SpineCore, it uses an absolute complete different mechanism, and it can be beneficial for you. Okay? Once again, thank you very much. Jeannie's been here since almost 6 o'clock in the morning. She doesn't sleep at all, and she's been setting up everything. And we also thank Amanda for doing a broadcast blast to everybody. We have comments. I'm hoping that there'll be more of this. Absolutely, I'm keen. As long as you're keen, I'll wake up early as well. It's very early in Indonesia. Yeah, so
thank you so much,
no
Dr.
problem.
Fong, for this time. So thank you everyone who's watching live streaming with Dr. Anthony Fong. You can send more questions if you have questions. You can invite more people or your friends to like our page. And Dr. Fong will be back once a month, right, Dr. Fong? Okay. Thank you everyone, and good morning. Have a nice day.
Thank you.